Hello friends, myself Rahul Jadhav, secondary MBBS student from Dr. Ullas Patil Medical College, Jalgaon, and my topic name is Valoproic acid and treatment of epilepsy. Valoproic acid, sodium valproate. Welcome to the presentation of Valoproic acid, an effective therapeutic approach for the epilepsy management. This presentation will provide an overview of the benefits and mechanism of action of Valoproic. Valoproic appears to act by multiple mechanisms. A phenotype-like frequency-dependent prolongation of Na plus channel like inactivation. Second, weak attenuation of the calcium-mediated T current and enhanced release of the inhibitory transmitter GABA due to the inhibition of degradation as well as probably increasing its synthesis from the glutamic acid. Pharmacokinetics and adverse effect of valproic acid. Pharmacokinetics. Oral absorption of valproate is good. It is about 90% plasma protein bound, completely metabolized in liver by oxidation, and plasma T off is 10 to 15 hours. Adverse effect of the sodium valproate. The toxicity of the sodium valproate is relatively low, and that many symptoms like anorexia, vomiting, loose motion, heartburn are common, but it is in mild and at the higher doses, drowsiness, ataxia, tremors should be occur. Uses of sodium valproate. Valproic acid is the drug of choice in the absence seizures because good tolerability, and it is also one of the first line drug for the partial seizures and GTCS. Valoproic is the most effective for the myoclonic seizure, also useful in atonic seizure in which control is often incomplete, but valoproic is the drug of choice. Valoproic has some prophylactic efficiency in the migraines also. The given table is for the treatment of epilepsy, that is types of seizure, first line drug, alternative drug or reserve drug, and there are many types of the seizures like partial seizures, second generalized seizure, in generalized seizure, tonic-clonic seizure, absence seizure, myoclonic seizure, atonic seizure, third is febrile seizures and status epilepticus. The drug of choice for the partial seizures like carbamazepine, for generalized seizure valproate, earlier studied, tonic-clonic seizure carbamazepine, absence seizure valproate, myoclonic seizures valproate, atonic seizures valproate. Valproate is the main drug of choice for the many partial seizures like tonic-clonic seizure, absence seizure. The main point regarding to the treatment of epilepsy, anti-epileptic drugs suppresses the seizures but do not cure the disorder. The disease may be fade out though after the years after successful control. Choice of drug and dose according to seizure type. Need individual patient given in the previous table. There is trend to prepare newer anti-epileptic drugs because they are less sedative, productive, few side effects, and drug interaction are insignificant. Second, for changing one anti-epileptic drug to another, dose of the first drug should be gradually reduced and that second drug gradually increased till the second drug regimen is fully established. Third, use combination of only when reasonable monotherapies fail. Combining drugs with different mechanism of action such as prolongation of Na channel inactivation, facilitating GABA appears more appropriate. Fourth, the therapy with true drugs fails to achieve the adequate control. Addition of the third drug generally does not improve the response unless patients suffer from the more than one type of seizure. A single tonic-clonic seizure in the subject with no predisposing factor, development of the epilepsy, history of the head injury, family history of the epilepsy, neurological abnormality, brain scan, may not be merit initiation of anti-epileptic therapy. Sixth, the therapeutic regimen should be as simple as possible. The seizures diary should be maintained. All drugs withdrawal should be gradual, except in the case of toxicity. Prolonged therapy may be lifelong or at least 3 years after the last seizure is needed. Stoppage of the therapy may be attempted in selected cases. Features are favorable to withdrawal are childhood epilepsy, absence of family history, primary generalized tonic-clonic epilepsy, recent onset of at the start of the treatment. What is status epilepticus? Status epilepticus is the medical emergency. It is the medical emergency characterized by prolonged or repeated seizures without fully recovery in between. It can be caused by various factors such as brain injury, infection, or medication withdrawal. Symptoms may include uncontrolled shaking, loss of unconsciousness, and confusion. Prompt medical intervention is crucial to prevent the complication and ensure the best possible outcome. And treatment for the status epilepticus. There are several treatment options available for the status epilepticus, including emergency medications to stop ongoing seizures, anti-seizure medications for the long-term treatment, and in some cases, surgery to remove underlying cause. It's important to work closely with healthcare professionals to determine the most appropriate treatment plan to tolerate to each individual need.
Thank you, manager.
For the MCQ point of view, first line anti-epileptic drugs are sodium valproate, carbamazepine, and lamotrigine. Understand their efficacy, dosing, and potential effect and adverse effect. It is also important for the MCQ point of view. Special population. Epilepsy affect individuals of all ages, including special population. Learn about unique consideration in the pediatric and generic patient, as well as pregnant and breastfeeding women. Tailor your approach for the optimal outcomes. And thank you.